Hello. Welcome to Casre4You Project, the project that is built to help you develop your skills as a senior caregiver. This course is about communication with the elderly. This competence is considered one of the most important competencies to develop in caregivers. In our aging society, the rising number of senior people has impact on the functioning of healthcare systems. In the future, most of the healthcare professionals all over Europe will work with senior people in different settings, for example, in the community, at home, and in long-term care situations. However, both formal and informal caregivers are largely unprepared to cope with the needs of senior citizens. The complexity of healthcare needs in old ages increases, and dealing with those needs requires specific competencies such as communication. In this webinar, a set of learning objectives focusing on communication are proposed, which we consider essential to be achieved by you, a professional caregiver of senior people. In the end of this course, you should be able to understand the specific dimensions of communication in senior care settings, recognize the requirements of communication when working with senior population, understand the value of communication for the quality of healthcare and the promotion of well-being of senior population. Now, let's think about the definition of effective communication. Considering the person's, effective communication must be clear, seeing the person's individuality, dignity, take into account personal and social background, and needs. Effective communication must be anchored on empathy, trust, confidence, respect and reciprocity. Now, let's see what you need to know more about effective communication. To be competent in communicating with seniors, different skills are needed, like skills related to questioning, explaining, and providing information, listening, and reinforcing, including both verbal and non-verbal aspects. To communicate in a positive and effective way, caregivers need to give the right information, in the right way, to the right people. The ability to ask questions is a core skill in healthcare settings because it determines basic information for diagnosis, counseling or any type of intervention. Explaining and providing information is determinant to the understanding of problems and other aspects of care, for example, health outcomes, seniors' satisfaction and adherence to treatments, practical instructions related to medication or other specific interventions, to correct mistaken beliefs and to promote self-management in health. Professionals should listen to the senior person but also show that they are listening carefully to what is being said, together with the associated non-verbal behavior and paralinguistics. In fact, active listening can be one of the most difficult skills to develop. Active listening is critical to gain a full understanding of the senior's problems and associated feelings, to communicate interest, to encourage openness and to develop a more person-centered style of interaction. Reinforcement is also a central skill to foster positive interpersonal relations with senior people. The key behavioral components of reinforcement include acknowledgement, confirmation, paying compliments and making supportive and evaluative comments. Professional health caregivers can use such behaviors with senior people to reinforce positive behaviors and health outcomes. Because senior people may have special communication needs, professional caregivers should be aware of specific communication requirements when working with this population. And why is it important to be aware of the communication strategies? What should be considered when caring for a senior person? Thinking about communication strategies is fundamental to ensure that senior people can participate as active citizens no matter where they live or their support needs. Nonetheless, communicating effectively with senior people can be challenging since they can show specific communication needs, and professional caregivers may have to develop special competencies to communicate with older people. Here are some performance indicators that can help you to reflect on and shape your communication strategies in care encounters with senior people. Understand the older person's individuality, identity, background, developmental path, expectations and needs. Respect individual and cultural diversity in care and services, including diversity of attitudes and beliefs about aging and well-being. Be aware of and avoid cultural biases during care. Promote positive, trusting, and symmetrical relationships. Adjust the form of communication depending on the characteristics of the older person. Assess possible barriers to the older person receiving, understanding, and giving information. Use active listening during different situations of care and support. Listen to the older person's concerns and allow extra time when needed. Be aware of the nature of relationships of the older person with his/her family/caregivers, and of the possible, positive/negative, effects in care and support. Be able to relate and communicate with the older person and his/her family/caregivers individually and in small groups. Use diplomacy and tact in fraught situations and handle tense situations. Address conflict situations positively, show respect, listen to the involved parties, and achieve common ground whenever is possible. More things to reflect, and ask why it is important. Are you really aware of psychosocial factors that can influence communication when caring for a senior person? Negative attitudes and discriminating behaviors of professionals based on age categorization, called ageism, reflect a form of social and cultural bias that negatively impact on the effectiveness of communicational processes in care settings, and consequently on the quality of care. Professional caregivers need to be aware of their own ageist attitudes, since these endanger the way older people are treated and compromise the quality of care. For example, in the context of medicine and nursing, professionals tend to speak louder and with a patronizing speech, often treating senior people like children rather than as fully functioning adults. Also, when senior people are accompanied to consultations by a third party, spouse or children, professionals often communicate directly with the other, particularly if they are younger, rather than with the senior. Now, to keep in mind. Educating professional caregivers about the importance of relational and communicational skills can lead to improvements in the process of care and, consequently, benefit the well-being of older people. For that, remember, each person is unique, has a story, life experiences, individual abilities, so interpersonal communication is also unique. Communication differs from culture to culture and therefore must be respected. Positive communication promotes an empathetic relationship. Active listening is always the best communicate attitude. Effective communication promotes social and family integration. One more, reflect about communication. There are countless communication issues, dilemmas and special challenges for professionals who work with the senior. As a caregiver, it is important that you understand some characteristics related to aging that impact on communication. In addition to knowing the characteristics of aging, it can positively influence communication with the senior by establishing a respectful, patient, and caring interaction. Being that the best approach in communication is to talk to the senior and not talk to them. The process of communicating with the senior can be challenging when associated with mental health, anxiety and/or depression, cognitive, memory loss, and sensory problems, hearing and visual impairment. On the other hand, the sender, in this case the caregiver, can sometimes adopt certain characteristics in his speech that compromise effective and efficient communication. Effective communication requires that all elements of a communication system play their roles, as shown in the following model. Overall, effective communication with seniors individuals often requires greater sensitivity and patience than normal. Bearing in mind the changes in hearing, speech, language, and cognition that are part of the normal aging process, some communication and counseling strategies can be optimized. Are you able to recognize communication skills? Let's see some examples about using infantile communication. When you say, "You behaved very well. My little darling managed to do everything." You are infantilizing the person. Maybe you can say, "Today you are working very well. I am very proud of you." When you say, "You can hurt your little fingers. Let me do it for you, my princess." You are using infantile communication. Maybe you can say, "It's a difficult task for everyone. How can I help you?" Verify if you are using infantile communication towards the senior and not respecting their autonomy as adults that they are. Verify if you are, unconsciously, using a controlling communication style. The tendency is to speak differently with the senior, such as oversimplification of vocabulary, childishness, use of exaggerated intonation with higher pitches or strong vocal intensity. The so-called baby talk arises spontaneously when dealing with older people and is characterized by affectionate and controlling speech. Generic terms such as darling, sweetie, mommy, princess is used in a high-pitched, sweet voice as if you were talking to a baby. Are you able to recognize communication skills? Let's see some examples about using overtalk in communication. When you say, "I already told you that you have to be careful with the cold," you are using overtalk communication. Maybe you can say, "They announced that today was going to be colder. Do you think we have to be more careful and wear more clothes?" When you say, "Today, yes. You have some colors that look good on you." Maybe you can say, "That color suits you very well." This is another common style, the overtalk, and is characterized by an overly personal and informal conversation accompanied by tapping or patting on the shoulder. It is important to assess familiarity with a senior person and use less paternalistic or condescending compliments. Are you able to recognize communication skills? Let's see some examples about using directive talk in communication. When you say, "You've used the call button 5 times today. What you want?" you are using over directive talk in communication. Maybe you can say, "It seems that today you are in greater need. How can we help?" When you say, "We've heard him crying a lot. Can you stop?" Maybe you can say, "It seems that today is a less good day. Can I help with something?" The so-called directive talk is used with the intention that a person performs a specific task, for example, taking a medication, doing a specific exercise, or interrupting a certain behavior, such as moaning, crying, or using the nurse call button frequently. This form of communication is mostly controlled with little to no care. The sender's goal is to get the person's agreement by being controlling and having minimal interaction, caring. Are you able to recognize communication skills? Let's see some examples about using superficial talk in communication. When you say, "It was much better for people to hurry up. We're a little late," you are using over superficial talk in communication. Maybe you can say, "Do you think I could help with anything?" When you say, "Mistakes after mistakes, you can't take it anymore." Maybe you can say, "Do you think I could help with anything? You are repeating an error. Can I help?" A superficial talk is neither affectionate nor controlling, however it can be considered rude. This can occur when the caregiver discusses the senior person as if the person were not present, or when he or she disregards the person's expressions of feelings or needs by abruptly changing the subject. Rather than seeing superficial conversation as neutral, neither caring nor controlling, it may be perceived as indifferent and disrespectful. Are you able to recognize communication skills? Let's see some more examples about using strategies in communication. When the communicative behavior considered disruptive, irritability, anger, confusion, perseverance in the topic of conversation, difficulty understanding, of the senior related to states of depression, anxiety, dementia. Becoming aware and understanding that certain topics of conversation in the speech of the senior are normal helps to take a fitting position and reduce communicative stress. Help in seeking expert support. Related to aging, there is an increase in emotional openness, a decrease in filters, an increase in honesty, the expression of feelings such as sadness, fear, anger, also the tendency to become more spiritual, makes them develop more topics related to death and past events. The reminiscence of the past appears as social support in the sense of seeking serenity in the face of death. Are you able to recognize more communication skills? About strategies in communication and the sensory, auditory, visual losses, am I considering that, when I am communicating with senior person? Not hearing or seeing well can be a barrier to effective communication. When communicating with the senior person with hearing loss, ensure that there is good lighting to see their face and make eye contact. Speak clearly, but not excessively loud. Personal amplifiers can be used to help with receptive language. When in visual loss situations, you should start talking as soon as you enter the person's line of sight and verbally identify yourself by saying your name and personal characteristics. Are you able to recognize more communication skills? About strategies in communication and giving enough time to respond and not creating pressure to get a response during a conversation with a senior. The senior's response time is necessarily slower, and due to their characteristics, they will need to maintain tangential conversations to have social contact. Narratives with ambiguous references, using pronouns instead of names, are common, which can cause difficulties. In that case, you should direct the conversation to a concrete and present topic to encourage the establishment of a fluid conversation. The message format used can have an impact in this situation. Avoid question-answer formats, particularly closed-ended questions, to elicit information and allow enough time for the person to respond to open-ended questions. Provide opportunities for the person to initiate topics and ask questions. In short, using good communication strategies with older people has a positive impact on health and social care. Using assertive communication optimizes care in general. Summary. Communication is central to all forms of relationships occurring in different settings, including health care. Interpersonal skills of caregivers make a significant difference in the quality of care and patients' quality of life, well-being and satisfaction. A competent caregiver promotes positive relationships and adopts effective communication strategies with senior people and their families or informal caregivers. To know more about communication, please see this list of links that include same complementary materials, such as videos, presentations, etc., and further readings. Additionally, you will find more cases to apply effective communication. Hope you have enjoyed this webinar. Thank you for watching.